will be discussing your erythrocyte sedimentation rate. Now, your erythrocyte sedimentation rate class, also known as your ESR, is used as an index on the presence of active diseases like TB, tonsillitis, rheumatic fever, and rheumatic heart disease. So when you say index class, this would act as a indicator. So ginagamit to dati. Dati ha, I would repeat dati kasi this is an old school test. This was usually used before to determine if a patient has TB, tonsillitis, rheumatic fever, and rheumatic heart disease. Itong apat na to class, these are, in a general classification, these are all considered inflammations. Sa madaling salita, to further simplify it, yung ESR nyo is usually used to detect inflammations in the body. Again, your ESR is used as an indicator for the presence of active diseases such as TB, tonsillitis, rheumatic fever, and rheumatic heart disease. In a general aspect class, it is used as an indicator to determine if there is inflammation in the body, inflammation of the tonsils, inflammation of the lungs, inflammation of your heart, and even your joints. This can also be used in diagnosing gout and arthritis. And as you know, ang arthritis nyo class, this is the inflammation of your joints. Now, your ESR, the principle will depend on the fact that in the blood to which anticoagulant has been mixed, the red cells would sediment until they form a packed column in the lower part of the tube or container. So if you recall class sa phlebotomy nyo, sa order of draw nyo, sa EDTA nyo, you would put a certain amount of blood, depende sa required volume ng tube nyo. There would be an exact amount of anticoagulant. Now you would have your whole blood. Now itong whole blood nyo, this is your blood plus anticoagulant. Now ang principle ng ESR nyo is that the whole blood, yung whole blood nyo, yung red cell niya would settle. Magsisettle siya. Magsisettle, when you say settle, magsisediment. Pupunta sa baba yung red blood cell. This is the rate of process depends on the number of factors like rouleau formation, concentration of fibrinogen, alpha and beta globulins in the plasma. So depende daw yung bilis, the speed of settling, yung pag-settle or yung pag-sediment, erythrocyte sedimentation rate, speed of sedimentation would depend, nakadepende daw sa number of factors like rouleau formation, yung stacking of coins, yung dami ng fibrinogen sa plasma, and your alpha and beta globulins as well. Now, this is the rate of fall of RBC and is reported in millimeters at the end of 1 hour. So imagine this would be your tube na gagamitin nyo sa ESR class. Maglalagay kayo ng blood dyan, then you would wait for an hour, and kung saan nyo makita yung line na nagsettle yung RBC nyo, that would be your ESR to be reported. I will show that to you later. Any questions? Okay. Now, your stages of ESR class would include 3 stages. The first one would be your agglomeration stage. Your agglomeration stage class, this is the first period of 10 minutes. So, di ba 1 hour yun? So, the first 10 minutes class is your agglomeration, wherein rouleau formation takes place. So, nag-i-stack yung mga RBC nyo. So imagine this would be your tube. Mag-i-stuck yan dyan, class. Ganyan. Then after, another stage would be your stage of fast settling and would occur 40 to 90 minutes. Class, itong 90 minutes na to, this is based on a different technique. Mamaya ito explain ko sa inyo. Let's just focus on the 40 minutes. So the second stage, the stage of fast settling would occur within the 40-minute stage and would be the settling or sedimentation occurs at a constant rate. So bumababa na, class, yung mga rulo nyo. Nagsisettle na sila pababa. They are starting to settle at the bottom. And the last 10 minutes or the last stage is the final phase of packing. There is a slower rate of fall during which packing of the sedimented column occurs. And this would occur for 10 minutes. So ito na siya, class. Nag-settle na talaga siya. Okay, so again, agglomeration stage, first 10 minutes, nagrurulo formation. Stage of fast settling would occur in the 40-minute mark. Nag-i-start na mag-sediment siya in a constant rate. While yung final phase of packing, bumabagal na, class, yung pag-fall ng RBC nyo. And sedimentation of the column would occur. Now, there are different methods for your ESR determination. Let's start with the macro method. Now, like your hematocrit method, you would be using your Wintrob-Landsberg method. Now, the normal value for this would be for men is 0 to 7 millimeter per hour. For women, it is 0 to 17 millimeter per hour. While for children, it is 1 to 15 millimeter per hour. And the known method, the most commonly used method nowadays, is your Westergren method. Now, your Westergren method, class, would use 3.8 sodium citrate. So, ito yung black top, class. This is the black top. Pag tinanong kayo sa board exam nyo, what is the concentration of your sodium citrate in Westergren or ESR? It's 3.8%. Kapag tinanong kayo naman ng what is usually used for coagulation studies, it is 3.2%, yung light blue top. So don't forget that, ha. Pag 3.8%, ESR, black top. Pag coagulation studies, 3.2%, light blue top. Now, in your Westergren class, you would use a tube with a length of 200 millimeters. Merong bore of tube na 2.5 millimeters. Normal value nito, class, is 3.5 millimeter per hour. Or kung gagawin mo siyang 2 hours, kasi may ibang variation ng Westergren, na instead of 1 hour na binabasa, kaya nga earlier class, there is a 90-minute here sa stage of fast settling nyo. So yung 90 minutes na to, you could use this in the pag 2-hour method yung gagamitin. So for the normal value sa 1-hour method ng Westergren nyo is 3 to 5. For 2 hours, it's 7 to 15 per 2 hours. While for the women, it's 4 to 7 millimeter per hour or 12 to 17 millimeter per 2 hours. Another method would be your Graphic and Cutler method. So in your Graphic and Cutler method class, you would be using 3% or 3.85% sodium citrate. The length of the tube is 0 to 50 millimeter. Normal value for men is 0 to 8 millimeter per hour. For women, it is 0 to 10 millimeter per hour. Itong Graphic and Cutler class, hindi ko pa ito na-encounter sa laboratory. So maybe in some countries ginagawa nila to, but for the Philippines, for the US, ang ginagamit nila is either your Westergren or your Wintrob-Landsberg. And another method would be your Linsen-Mayer method. So this time it would be using 3.7% sodium citrate. It has a length of tube with 65 millimeters. Meron siyang two calibrations at 1 millimeter and 18 millimeters. So pag sinabi mong two calibrations class, imagine this would be your tube. One side, sa isang side, there is a 1 millimeter, while the other side would have your 18 millimeters. So pwedeng dito yung 1 mm, then dito yung 18 mm. Now, the bore of the tube is 5 millimeters plus. Normal value is 350 to 600 minutes per men, and women is 300 to 600 minutes per woman. So, ang tagal class, this would last for 60 minutes. So, around 6 hours to 10 hours mong aantayin bago mo siya basahin. Then 5 hours to 10 hours for women. So hindi ko siya i-consider na very applicable sa laboratory. Kasi masyadong matagal. Okay. Now, here are some point of difference class sa Wintrobe nyo and Landsberg and Westergren method. Sa tube nyo class, sa Wintrobe, let's focus on three aspects. Yung bore, yung calibration, at yung length. So please do remember this, but I will upload a video of this so you could review it again. Ang bore ng Wintrobe new class is 3 millimeters. Ang calibration niya, so when you say calibration niya, yung mga markings. So imagine this would be the tube. So it usually starts at 0, then it would end at 100 millimeter. So ang calibration ng Wintrobe nyo is 0 millimeter to 100 millimeter. Then yung length or yung haba ng tube is 115 millimeter. While your Westergren naman class, ang bore niya is 2.5 millimeter. Ang calibration niya is up to 200 millimeter. And yung length or yung haba is up to 300 millimeter. So mahaba siya class. And then for the anticoagulant, as you recall, sa Wintrobe, ang ginagamit natin dyan class is your double oxalate. While for your Westergren, it is your 3.8% sodium citrate. Black top. Sa number of reading, so when you say number of reading, kailan mo siya babasahin? Sa Wintrobe class, there is only a single reading. And when I say single reading class, you would read it only after 1 hour. So let's say nag-start ka ng procedure mo ng ESR ng 8 a.m., you would be reading the final result at 9 a.m. And then sa Westergren naman class, 2 readings. So sabi ko kanina, di ba, pwede siya ng 2 hours. So pwedeng after an hour or after 2 hours. Depende. Then sa dilution naman class, when I say dilution, is it possible to mix it with, is it possible to use EDTA? Then mix it with sodium citrate. Sa Wintrobe class, it's not allowed kasi double oxalate na yung gamit niya. So, no dilution. Sa Westergren naman, pwede. You could use 0.6 ml of 3.8% sodium citrate with 1.4 ml of blood na may EDTA. Examples lang yan, class, in cases na wala kayong black top. Ang EDTA meron kayo. If you know how to prepare sodium citrate concentrations or mixture, pwede mong gawin yan. So you could use 1.4 ml ng whole blood nyo, yung blood na may EDTA. Then you're going to mix it with 0.6 ml of 3.8% sodium citrate. Then let's talk about sensitivity. So ang sensitivity class ng Wintrobe nyo is, it is less sensitive. While your Westergren is more sensitive. Corrections for anemia. So if the patient is anemia, is it possible to perform correction? So Wintrobe class, yes, it's applicable. Pwede. For Western grain, sadly, hindi siya pwede. Not applicable. Other tests can be performed. So sa Wintrobe class, di ba diniscuss ko sa hematocrit nyo, you could use the Wintrobe tube for hematocrit determination. For your Western grain, wala. Specific lang ang Western grain nyo for ESR. Pag disadvantages naman niya, yung Wintrobe nyo is not very sensitive. Short column of blood. So remember, ano lang siya, 115 millimeters lang siya. Short column. Ano pa ba? Excessive oxalate. So let's say na yung double oxalate na na-prepared is hindi tama yung concentration or yung amount, magkakos ka ng excessive oxalate. So kapag excessive ang oxalate nyo, class, mag-shrink si RBC nyo. And then naman dito, dilution. So Western grain naman, dilution can cause errors. Dilution can cause errors. Matrabaho to, class. So, cumbersome. So, when you say cumbersome, matrabaho. Tapos, large amount of blood is used. Kasi, di ba, 300 millimeter yung length niya. So, you would need at least, siguro mga 3 ml or more than 3 ml of blood. Large amount of blood is used. Ayan. So again, yung disadvantages ng Wintrobe nyo, not very sensitive, short yung column, excessive oxalate can lead to shrinking of your RBC. Well, for your Western grain, dilution can cause error, cumbersome, pag sinabing cumbersome, matrabaho, and it would require a large amount of blood. Now, let's proceed to your micro methods naman in ESR. So we have your micro-Landau method. So your micro-Landau method would use a tube with a length of 12 centimeter. It has a bore of a tube of 1 millimeter. Calibration of the tube are 12.5 and 62.5 millimeter. Then we also have the Smith method. It uses capillary pipette, 230 millimeter long and 1 millimeter internal bore. And we have the Hellige-Vollmer or Christa method. Okay, let's discuss your ESR by Western grain method. So let's talk about your equipment and reagents. The first one would be your Western grain tubes. Now, class, depending on the laboratory, kung social yung laboratory nyo, let's say medyo modern yung lab nyo, may budget, they would often use disposable plastic tubes. Pero kapag medyo old school or classic, mga matatanda yung ano nyo, they would often use the reusable glass tubes. So when you say reusable glass tubes class, yan yung pwede nyo pang hugasan at gamitin ulit. But nowadays, ang pinaka ginagamit ng mga laboratories would be this, yung disposable plastic tubes nyo. Pero kapag nag-intern kayo, mataas ang possibility na ito ang ma-encounter nyo, itong reusable glass tubes. Now, you would be required to use your black top, which contains 3.8% sodium citrate. So here in the arrow, you can see here, this is the amount of your sodium citrate. So you're going to fill it with the required amount of blood. So remember class, in any tube, you must remember to always follow the marking. Kung saan nyo nakita yung marking, hanggang dun lang yung amount of blood na ilalagay nyo. Do not go beyond, do not go over it. Then, ESR should be performed within 6 hours after collection. So let's say kinulek mo ng 7 a.m., you have to process it before 1 p.m. Now, yung sabi ko nga, pwede kayong mag-dilution sa Western grain. Now, let's say that you use an EDTA sample. Wala kayong black top. So you could add 0.4 ml, 3.8 sodium citrate, then mix it with 1.6 ml of EDTA blood. So that is in the case of you're going to use EDTA blood plus. So 1.6 ml EDTA whole blood plus 0.4 ml sodium citrate. So yan yung possible na dilution na pwede niyong gawin. So when performing ESR class, remove the cap, remove the cover, the cover of the tube. Make sure class prior to remover that you would position the tube in a straight position. Wait na lang class. So you need to position the tube class in a straight and steady manner. So para mag-iwas kayo ng spillage. After that class, this one, you're using a disposable Western grain tube. So ang gagawin nyo lang dito, class, is that you're going to put it, ang itsura kasi ng disposable Western grain tube nyo, class, ganito. Tapos meron siyang parang puting plastic, ano naman ganun kalaki, puting plastic. Now, this is what, ito siya. So ipapasok mo siya, imagine this would be your tube. Ipapasok mo siya sa loob on a downward manner. And then kapag pinasok mo siya ng ganyan, it would automatically push or pull the blood up. It would pull the blood up. So, ganyan itsura niya, class. And then, after that, you would set the timer. So, ikaw, if you want 1 hour, pwede rin 2 hours. Depende sa'yo. So set main timer 1 hour. Then read where the cells sediment separated from the plasma. So if you could see here, class, ito yung plasma. So you would read it around this marking. Para ka lang ding nagbasa, class, ng hematocrit. The only difference this time is mas malaki yung tube nyo. And hindi masyado kita or wala kayong makikitang buffy coat. So you need to report the result at the end of 1 hour in millimeters. Then dispose any biomedical waste depending on your guideline. So precautions, class, specimen should be used within 6 hours after collection. Blood in EDTA tubes can be used for up to 24 hours after collection, provided that it is kept at 4 degrees centigrade. So class, do remember that all your whole blood, whether EDTA yan, whether sodium citrate yan, whether kahit anong anticoagulant yan, the best storage would be at 4 degrees centigrade or your refrigerator temperature. Then use the correct type and proportion of anticoagulant. So sabi ko nga kanina, class, if you have excessive anticoagulant, pag excessive ang anticoagulant yung class, that would lead to shrinking of the cells. At kapag nag-shrink yung cells, class, you would have an elevated ESR. Kasi ang bilis niya mag-pack dahil ang liliit ng cells. Then you have to perform tests on non-hemolyzed sample. So use disposable sedimentation tubes. Depende sa yan if gusto mo ng disposable. Pero sabi ko nga, mas safe ang disposable kaysa lilinisin mo ulit. Kasi mamaya may sakit yung blood na ginamit nyo. Then you have to keep the tubes upright. So sabi ko nga, it should be in a steady or stable position. Ensure that there are no air bubbles while filling the tube. So let's say, class, ito yung Western grain tube nyo. Habang nag-fill kayo, bigla nagka-bubbles. So kapag magkaroon ng bubbles yan, class, you have to repeat the procedure. Keep away from heat source or direct sunlight. Then keep away from any vibrations like your centrifuge. So pag nag-vibrate kasi yan, class, there would be faster packing of the RBC. Magkakaroon kayo ng falsely elevated ESR. So your ESR are increased in different disorders. So we have your hypercholesterolemia, hyperfibrinogenemia, hypergammaglobulinemia. Now, itong tatlo na to, class, this is in a simple, this would have increased presence sa plasma nyo. And kapag increase ang presence niya sa plasma nyo, your RBCs tend to be heavier. Nag-a-attach kasi sila sa RBC niya, yung cholesterol, yung fibrinogen, yung mga gamma globulins. And when they attach that, the RBC becomes heavier. That would lead to your increased ESR. Kasi yung RBC nyo, mas mabilis yung settling. Okay? Questions? Andyan pa kayo, class? Hello?
Andyan pa,
Hello?
sir.
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So I have a question. What's the biggest protein class that could be found in your blood based on your CC? Ano yung pinakamalaking protein class? Siguro madami kayong... hindi sa serum. Yung pinakamalaki yung protein. Protein type. Pero maraming type. Hindi serum. Maraming types ng protein na makikita sa blood. Jo, tama. So, ano yung largest type of protein class?
Albumin, sir.
Alright, it's your albumin. Now, here in hypoalbuminemia, so in this type, in this case, you have decreased albumin. Now, yung albumin nyo kasi class would tend to float. Hindi naman float technically. They would have more presence in the blood. So when they have more presence in the blood class, they would tend to block the cell components. Now imagine this would be your Westergren tube. Ngayon, gusto na ng mga RBCs mo bumaba, mag-settle. Pero since maraming albumin doon, hindi siya kagad makapag-settle. But in the case of hypoalbuminemia, or in the word hypo, meaning decrease, onte lang yung albumin nyo, wala na yung harang or wala na yung blockage. And that would lead to your red blood cells settling faster. They would no longer be blocking or stopping the red blood cells to settle. Then we also have your anemia and macrocytosis. So sa macrocytosis, if you recall, larger ang RBC surface. And kapag larger ang RBC surface nyo, most likely heavier si RBC. And kapag heavier si RBC class, mas mabilis ang pag-settle, leading to increased ESR. Then there's also leukemia. There's also due to different drugs such as your dextran, penicillamine, procainamide, theophylline, and vitamin A. And there are other possible causes of increased ESR are acute heavy metal poisoning, acute bacterial infection. So let's discuss this too. Acute heavy metal poisoning. So an example of this would be your lead poisoning. So si lead poisoning nyo kasi class, if you would recall, could cause macrocytosis, and that could lead to a bigger red blood cell, and that would lead to faster settling. Then we also have your acute bacterial infection. So certain bacteria would attach to the RBC. And again, that would lead to a heavier RBC, leading to faster settling. Then there's also your collagen vascular disease, diabetes mellitus, end-stage renal failure, gout, malignancy, menstruation, multiple myeloma, myocardial infarction, pregnancy, rheumatic fever, rheumatoid arthritis, syphilis, and temporal arteritis. So you may be wondering, bakit hindi na ginagamit nowadays ang ESR kung ganyan kadami yung diseases na pwede niyang ma-detect? The problem kasi class with ESR, it is not specific. Hindi siya specific class. It cannot accurately detect a single disease. Kaya nowadays, ang pumalit sa ESR nyo is what we call the test CRP, also known as your C-reactive protein. Pag naka-encounter kayo sa internship nyo or in the future ng hospital na saan magtatrabaho kayo na old school ang teacher nyo, baka ma-encounter nyo tong ESR pa rin ipapagawa sa inyo. But nowadays talaga, it is no longer recommended to use because it is not that specific. It does not accurately detect a single disease. Masyado siyang general class. Masyado siyang maraming sakit na ano. So, replacement would be your C-reactive protein, which has a specific detection for inflammations. Aside from that, mas madaling gawin. Di ba nga cumbersome yung Western venue matrabaho. Easier to perform than ang CRP. Then it will also be increased in refrigerated specimens not returned to room temperature. Then it could also be in high room temp, tilted ESR, and vibration. So kapag nag-vibrate nga class, so your RBC would settle faster. Now, you will have decreased ESR naman in hyperalbuminemia, hyperglycemia, hypofibrinogenemia, hypogamma globulinemia. So dito naman class, there would be in this hyperalbuminemia and hyperglycemia, you would have increased albumin and increased glucose sa blood nyo. So when that happens class, there would be more blockage. And that would lead to slower settling. Mas mabagal yung pag-settle ng inyong red blood cells. And then there would be also increased bile salts, increased phospholipids, acanthocytosis or anisocytosis, hemoglobin C, microcytosis, polycythemia, sickle cell, spherocytosis, and your thalassemia could cause decreased ESR. So sa mga poikilocytes nyo kasi class, and even your anisocytes, meron kayong variation ng size and shape. So depending on the size of and shape, if the cell is bigger, mas magiging slower yung pag-settle niya. Depending, kasi nagbo-block, depende. If it's smaller, pwedeng faster. It would depend. Then, it would be also decreased in increased WBC, adrenocorticotropic hormone, ACTH, cortisone, ethambutol, quinine, salicylates, cachexia, congestive heart failure, newborn status, clotted blood specimen, delay in testing. So that's why you need to process it within 6 hours. And then if there are bubbles in your ESR column. So pag may bubbles class, ang recommendation, i-repeat nyo. Then if there is lower room temperature, if there is narrow ESR column diameter. Now here are some of the sources of error class in your ESR. If the concentration of your anticoagulant is increased, the ESR will be falsely low as a result of the steering of the RBC. So when you say steering class, this would be your shrinking. Lumiliit sila. They would now become what you call parang spirocytes, which would inhibit Rulu formation. So di ba nga, the first stage yung agglomeration nyo. The first stage is your agglomeration, which is the formation of Rulu. Nagpo-form ng Rulu. Nagpo-form ng Rulu. Now, kapag hindi nakapag-perform ng Rulu formation class, that would lead to a falsely low or decreased ESR. The anticoagulant sodium or potassium oxalate as well as heparin can cause the RBC to shrink and falsely elevate your ESR. So, kung gagamit kayo class ng double oxalate, which is a combination of your sodium and potassium oxalate, if there is incorrect amount, that could cause a shrinkage of cell and a falsely elevated ESR. Then a significant change in the temperature of the room can alter the ESR. Even a slight tilt of the pipette can cause your ESR to increase as well. Now, blood specimens must be analyzed within 4 hours of collection. So dito 4 hours, sa ibang book 6 hours. If it kept at room temperature, if the specimen is allowed to sit at room temp for more than 4 hours, the RBC starts to become spherical, which may inhibit the formation of rouleau. Blood specimens may be stored at 4 degrees for up to 24 hours before testing, but must be rewarmed by holding the specimen at ambient room temp for at least 15 minutes. So class, just to simplify this, you need to process the specimen within 4 to 6 hours and should be kept at room temp. Tapos, you need to store them at 4 degrees centigrade for 24 hours if hindi kayo makapag-test agad-agad. Then, it must be rewarmed. Kailangan nyo munang ibalik sa room temperature yung specimen before testing. Then bubbles in the column of the blood invalidates the test result. The blood must be properly filled to the 0 mark at the beginning of the test. A clotted specimen cannot be used. The tubes must not be subjected to vibrations on the lab bench, which can cause increased ESR. Hematologic disorders that prevent the formation of rouleau, such as your sickle cells and spirocytes, decrease ESR. The ESR of patients with severe anemia is of little diagnostic value because it will be falsely elevated. Kaya nga whenever class may anemia yung patient niya, ang best diagnostic kit dyan would always be your hemoglobin, hematocrit, your indices, and your RBC count. Sa apat na yan class, ang best para ma-identify mo yung anemia would always be your indices. So that ends our ESR discussion. So any questions?
Sir,
Yes.
yung sa ano, good sir, sa table, yung sa mga differences, pa-clarify sana ko sa ano, sir, sa dilution, 0.4 yun siya, sir, or 0.6?
Nag-iba nga kami ng libro eh. Sundin mo to course. Ito sundin mo. Follow mo tong excuse me. Sundin mo to course. 0.4 ml ng 3.8 sodium citrate. Tapos 1.6 ml of pentablood.
Opo. Thank you, sir.
4.6 dito. Okay. So either is acceptable. Either is acceptable, Korea. Pwedeng 0.6 ml. Excuse me. So pwedeng 0.6 ml ng sodium citrate. Tapos, excuse me, 1.4 ml ng EDTA. So, it's either this or ito. Alin sa dalawang yan, pwede niyong gamitin. So we still have, so 23. We still have an hour. So, wala pa rin si Miss Matea. Happened to Yvonne. So you still have time for your seat work. Pili lang yung seat work na class. So we'll start at 2:30 and then you can end your seat work at around siguro mga 3:25 p.m. Lahat kayo naka-apply na ng PhilHealth? Wala pa? Sino may PhilHealth na? My God, may clip si Havison sa buhok. Dalawa pa. My God. May sungay. Under sa parents? Pwede yun? Ay, hindi. Paano under sa parents? Nakapangalan sa parents yung PhilHealth na gagamitin niya? Okay. Mga below 21. Okay. Tama. Kasi if 21 magkuha na. Karamihan naman sa inyo, di ba wala pang 21? So try nyo nang asakasuhin yung class kasi for sure. Wala pa rin kasing reply si Ma'am Yasmin. Wala pa siyang reply if anong gagawin sa 22. Okay, so I'll publish your seat work at 2:30. Then you have until 3:25 to finish it. Dali lang yung class. So reminders class, on Friday, you would have your presentation. Yes, Ms. Jacobo, what's your question? Okay. Pag mag-shrink siya, it would actually kasi spearing. Okay, let me correct. Thank you for noticing that. Current slide. Okay. So kapag nag-spearing, kasi ang iniisip ko dito na spearing niya, shrinking would denote to a smaller size. But if you would encounter the word spearing of the RBC, as in, hindi naman siya totally nag-shrink to to the point na magla-lyse siya, but it would have a decreased volume or surface. So whenever you would encounter the word spearing of your RBCs, that would inhibit rouleau formation. Thus, it would be falsely low or decrease. Kapag naman na-encounter mo naman yung word na shrink, nag-shrink yung RBC, it would cause falsely elevated ESR. Does that answer your question, Ms. Jacobo?
Opo, thank you, sir.